most skincare ingredients are not regulated. I know your jaw just dropped. Like most skincare ingredients are not regulated at all by the FDA, like at all.
Hello, and welcome back to another episode of the Birth Lounge podcast. I know that skincare is one of the most hot topics on the internet, and it seems like every time you open up a social media app, there's a new product, there's a new fad, there's a new buy this and it will save your skin. But are they true? Do they really work? And more than that, are they pregnancy safe? What about safe for your fertility? What does actually being a clean product even mean? Did you know that most skincare is actually not regulated by the FDA? That is a terrifying thought. We're putting something on our largest organ in our whole body, aka our skin, and it's not even being regulated by any sort of governing body. Nobody is looking into the ingredients that are going into these skincare products. That scares me to my core. I asked you guys on social media about skincare products. What were your biggest questions? What were your biggest hesitations? What were the biggest challenges that you were facing? Things like melasma in pregnancy, acne in pregnancy, of course, came up because I think it's something that so many of us deal with when we are pregnant and dealing with all of the fluctuating hormones from beginning to end of this journey. However, something that completely shocked me and kept coming up time and time and time again was Botox and fillers. Two things that I know absolutely nothing about. Now, I had shared previous to getting pregnant that I was a longtime user of retinol. I felt like it had done numbers for my skin. I loved my retinol, and I was quite frankly pretty sad to have to get rid of it when I was pregnant. But a big question mark that remained in my life and that I found out that you guys shared was, are retinol products actually safe in breastfeeding while you're nursing your baby? And what about retinol alternatives? Are there any, or do we really just have to wait several months, sometimes years, depending on how long you stay pregnant and how many babies you have, to use retinol again? Something else you guys were super curious about was sunscreen use. I've recently been sharing about my own journey with sunscreen, and I shared that I get outside every day without sunscreen, yet many of you were very surprised to hear that I still use sunscreen, not only daily, but while I was at a recent beach trip. Today is such a fun episode because I get to sit down with Claire O'Brien, who is a dynamic nurse practitioner, and she has her own skincare line, Skin Clique. I first started following Claire online because she, of course, shared about skincare options, but I quickly realized that she and I are cut from the same cloth. She is fun and vibrant. She believes in patient autonomy. She's very evidence-driven. She's cute, and she shares a bit about her fashion here and there. And her mission really extends beyond traditional medical aesthetics. She's really into shaping how we think about healthcare delivery while paving the way for women in leadership. I mean, do I need to keep going on why I love her so much? She is one of the coolest and most down to earth content creators I have ever had on the show, and she just happens to be absolutely brilliant as well. So, in today's episode, we are going to dive into all of those burning questions that you submitted to me. We're also going to talk about what does your daily regimen of skincare need to look like. And don't worry, we're not giving you a list of 50 things to do. We're breaking it down very simple, a 5 to 10 minute routine that will give you the most bang for your buck. We're also going to talk about some of those fads that you find online, like colostrum and collagen. Do they really help your skin? Plus, we're going to dive into one of my favorites, microneedling, and how can you prevent stretch marks. This is a highly requested subject. You guys ask me about skincare all the time, and while I love sharing what works for me, I am the farthest thing from an expert. So buckle up, grab your pen and paper, open up your Google so that you can start ordering the products that Claire recommends, and without further ado, Claire, welcome to the show.
Thank you for having me.
Of course, I'm so excited to have you. I just shared with our listeners that I'm a longtime follower of yours, and you've taught me a lot. And I know you're not a fashion influencer, but you influence me in fashion all the time because I think you are just a little
Oh
fashionista and you
gosh,
always look so cute. And I'm always like, oh my God, I need to buy that.
thank you.
I do.
It's such a weird, it's new for me to like put that out there too, but people are asking and I'm like, all right, I guess this is what we're doing now. So so thank you for
Yeah.
validating me in that. I feel a
Hey,
little
I love
insane.
it. Yeah, you're cute. You have really good style and it is, you do neutrals and you do sustainable clothes and now that I'm becoming a mom, I still want to be a fashionable mom. So I love watching how you do it. So thanks for sharing all of your links. But okay, I know we're not here to talk about fashion, you guys. So we will dive into the skincare because Claire, let me be honest with you. When I got pregnant, I had a really regimented skincare, and
Right,
I was pretty shocked because I think for me, it was like, well, I was already using clean skincare. A lot of my stuff was plant-based, and a lot of my stuff did not have a lot of chemicals in it. And so I
right.
was still really shocked at how many of my products were not pregnancy safe and or I couldn't use them in pregnancy. And so I think this is a topic that everyone's going to be so interested in. And I think I'd like to start there is the safety of who determines what's safe in pregnancy and nursing when it comes to skincare? How do we actually know? Are we testing these products? Are we taking a lot of products out of the hands of pregnant people because we're just not sure what they do to pregnancy and nursing? Or how does that work?
Oh gosh. Okay, so like yes to all of it. But let me back way up. And first, this is a great question of who's determining what is safe or there's a term called GRAS. I'm sure you say that probably 100 times a day, which is generally recognized as safe.
Oh,
So, the American College of Obstetrics and Gynecology, or ACOG, they actually have guidelines on very specific ingredients that will say, like retinoids, for example, or salicylic acid, glycolic acid, really the biggest main categories in skincare, the biggest ingredient categories, and they are actually doing like clinical studies on them, whether those be retrospective or cohort studies. And they have determined percentages or even specific ingredient classes that they are going to come out and say, like on their website, you can look it up. What does ACOG say about glycolic acid? So that's kind of the biggest umbrella. Now, underneath that, with skincare, you can imagine, and you said a couple words that I'm like, oh my gosh, yes, let's talk about this. It's like my favorite conversation to have. So, clean, plant-based, what does that mean? And does it mean it's better at all for pregnancy? So I think there's kind of two ways that you can think about it, right? So the word clean might mean something totally different to you than it means to me, right? So clean for me, for you right now, it might mean pregnancy safe. For me, it might mean maybe I have a gluten intolerance and I need gluten-free skincare. Maybe I am allergic to, I can't have fragrance. And that's what clean means. For some people, it means paraben free, phthalate free, sulfate free, fragrance free. There's so many different versions of what clean means. And plant-based can fall into that, right? So people might feel like plant-based is I'm using air quotes, like a cleaner alternative. But really, we could be using plant-based alternatives that are new. They've not been studied. They're not regulated by the FDA. By the way, most skincare ingredients are not regulated. I know your jaw just dropped. Like most skincare
Wow.
ingredients are not regulated at all by the FDA, like at all. It's Wild West. So it's a complicated answer, and it doesn't, other than a couple of pretty clear cut things that are a no-no, there's a lot of gray area. So I think that's what makes it so tricky for pregnant people to navigate is a lot of dermatologists I've heard will just say, and OBs and kind of people in general, but will just say, oh yeah, you can use, sunscreen and CeraVe and that's it. But that's also really doing you a huge disservice, especially one of my favorite things is our hormones fluctuate so much, obviously pregnancy, nursing, and periods and perimenopause and all of it. Acne, for people who have never had acne before in their lives, and all of a sudden they're pregnant and they're like, I feel like I'm in middle school, but they're kind of being told they can't really use anything. And that's simply not true. So that was a very long-winded, complicated answer to your question of how do we know and who's determining it.
Okay, but what are the answers to acne? So the people who are out there, oh
Hmm.
my God,
Hmm.
I'm now back in sixth grade. What do you say to those women?
Yeah. So there's an algorithm like in resources that we all use when treating acne from a clinical perspective. There's an algorithm of what's called first line defense and second, third line. And really the only big no-no in the first line of defense, and it's even a medium no-no right now, is retinoids. So retinoids are your vitamin A derivatives, and that really stems from the use of isotretinoin, which is Accutane, which is oral massive doses of vitamin A. Like we're talking 50, 60, 100,000 units a day of vitamin A. And so now I say it's a gray area because we've been using these topical retinoids for so long that eventually people find out they're pregnant and they're like, whoops, I've been on that for 6 months and who knew, didn't know. So then we get good retrospective data to say, okay, everybody's been fine. So it's still on paper a little unclear whether you shouldn't use topical retinoids or not. Isotretinoin or Accutane is duh out of the gate. There's an iPledge government program. You have to sign your life away that you're not pregnant while you're taking it. Like it is huge no-no. But that eventually got extrapolated and they just said to be safe, we're going to say no to the topicals too. So let's take all of that out of the picture. You've still got topical benzoyl peroxide, clindamycin, azelaic acid, glycolic acid, salicylic acid, lactic acid, mandelic acid. You've got about 15 heavy hitting topicals that you absolutely, topical just means like cream on top of the skin versus like a pill in the mouth, right? You've got a ton that has been studied and shown to be GRAS or generally recognized as safe and totally fine for pregnant women, pregnant people. Now, formulation and what else is in these products, it's hard to find them plain by themselves. So then we can talk about what does that mean for you? Are you looking for a plant-based alternative? Salicylic acid in plant-based form is willow bark. Well, so do you even know what you're using? They're just different. There's a lot of different verbiage to all of it. It can get complicated.
Yeah, it's so convoluted, and I do think there's just so much information that it can feel very overwhelming. I'm interested in the salicylic acid because I was told by my esthetician, and I want to dive into microneedling. So we'll do that in a little bit because when
Yeah.
I stopped microneedling, I asked her, like, okay, what else should I avoid? She told me retinoids, and then she also said salicylic acid. So are you saying that is typically considered safe in pregnancy?
Yeah, according to the American College of Obstetrics and Gynecology, yes. Yeah. Now, there are certain percentages that you'll hear. They'll say, don't, I think they might say, and we talked about, I'll send all this stuff to the show notes. I'll send everybody the links to, I'm looking at the same things you can look at online often on their website. You just have to know what to look for and what to find. But you might see something that says don't use salicylic acid in concentrations over 2%. You can't find that over the counter. You're not getting that. You as a consumer can't find that. Now, I have a chemical peel in my office that's 18% salicylic acid. I'm well aware that peel is not pregnancy safe. And you as a consumer can't go out and buy it. So I think there's a little bit of misinformation, even in the aesthetic community, just based on there's so much to know. And that's my job, right? I literally have to know even products that I don't sell, even lines that I don't carry. I've got to know the general gist of like all of it to help guide my patients because it is so complicated. But yeah, even things like that, it's really difficult to find and you can't grab it as a consumer on the shelf. So I'm like, yeah, you can go for it. Go ahead and get salicylic acid. Absolutely.
Yeah, there's already like safeguards in place that you're not going
Exactly.
to be able to access stuff that's dangerous for you and your baby. Okay,
Yeah, exactly.
when I got pregnant, obviously, like everyone, one of my most beloved products was retinol, and I used it every day, and I had
I
done the whole
know.
like taper up, so my skin was used to it. I was looking amazing, and obviously I had to get rid of that. So can we talk about retinol alternatives? When I put it out to
Yeah.
the community on Instagram, they had said this alternative bakuchiol.
Bakuchiol? Yeah,
Okay,
bakuchiol.
yeah, I'd
Yeah.
love to talk about that.
Okay, bakuchiol is a plant derivative.
Okay.
And it's been around for centuries, but it's been really noticed in the skincare community, I would say, for probably 40, 50 years. Bakuchiol and retinol head-to-head studies are actually really similar. And it's interesting. I wonder if there's a big retinol like secret lobby. Probably that we like don't know about that's trying to knock down Bakuchiol, but Bakuchiol by itself is actually hard to find. I know there are two companies or brands that make it. Isden is one, and I think their formula is called Melatonin, but I'm going to look that up and send it to you. And then Herbivore Botanicals.
Okay.
They used to make a plain bakuchiol serum. It's usually paired with a retinol, is what I see, but there are a couple that exist just plain bakuchiol. So the studies basically show that it's as efficacious as certain forms of retinol, and it's not systemically absorbed at all. Whether retinoids are is up for debate. You'll hear a lot of OBGYNs say it's fine, go ahead and use it. But out of an abundance of caution, and it's simply not worth it, if you want to use an alternative, the straight up alternative is bakuchiol. Now, there are a lot of people who will say, oh, this other acid is a retinol alternative. I really don't believe, other than bakuchiol, I don't believe there's another truly comparable alternative. There are plenty of great products that will stimulate cell turnover, exfoliate, do a little bit of maybe retinol just does so many things. The retinoid family does so many things, and we can talk about that too. There's prescription tretinoin is the mothership of everything, and then it trickles down from there into your more like adapalene, over the counter retinols, that kind of thing. But there's really not another ingredient that does all that it does. So it's tough for me to say, oh, this is an alternative. Now there's plenty of great stuff to use, but alternative straight up, I would say bakuchiol for sure.
Yeah. Okay. And then what about supplements? I mean, I know that collagen is everywhere, right? Colostrum is everywhere. Omega
I know.
3s are everywhere. I feel like we're just inundated on the internet about do this for your skin. This will fix your
I
skin. This will
know.
fill you up. What do we need to know about those supplements? Obviously, they're not one size fits all, but from a
Right.
data standpoint, what do we need to know?
So, my philosophy in a general sense on any supplement that you're talking about just for skincare is okay, anything like that should be only icing or even sprinkles over the icing on the cake. If you don't have a good at home, daily, consistent regimen, don't even bother. That's what I tell my patients. Don't even bother with collagen. Get on your sunscreen, which pregnancy, we can talk about that. Like zinc and titanium, you're great. Sunscreen, your vitamin C's, hopefully, your retinoid if you're not pregnant, your acids, that consistent skincare at home is really where the work and the transformation is happening. It'd be like going to the dentist twice a year and being like, clean my teeth, and we're not doing anything in between. It's just not the same. Now there is good data on, and actually more and more on collagen specifically. Really, and is it the protein aspect? Is it the collagen specifically? That I want to probably dive into honestly before I try to speak on that. But we do know there is good data on collagen and improving the look of the hydration of the skin, firmness, plumpness, that kind of thing. I throw it in my coffee every morning. I get the flavorless. And I'm like, if nothing else, I've had 15 grams of protein in my coffee. Great. So at worst, it's a probably a little bit expensive protein powder. At best, we know it actually does help. But don't even consider anything supplemental until you're on a good skincare routine. That's what I say every day. And the omega-3 is your first priority when you're pregnant. Omega-3 is great because you need that anyway. So your first priority needs to be your, oh my gosh, I'm like, now it's so funny what you know, what you don't know. I'm like, what are
Yeah,
we supposed to be taking? Like, I'm like, choline? Is that a thing?
it is definitely
What are we,
choline, and
what
you
are we
need your
taking?
omegas. Yeah, for sure.
I haven't done this in 8 years. I don't know. I took a prenatal, I think. I don't know. I just threw up all the time. So I don't think I was able to care as much about like my intake when I was pregnant. I was just barfing and I couldn't even look at a vegetable. I was like, oh my God. So you tell us what we need to take for pregnancy. And if omega-3s, I think, is part of it, then great.
It definitely is. Definitely is. Okay, and you keep talking about this daily regimen. What should that look like? Should we be putting on toner? We obviously moisturizer. Are we putting on sunscreen even when we're not getting outside? Do we need a specific maybe blue light sunscreen if we're staring at screens all day?
Ooh, oh, that's
What do we
such
need
a good
to know?
question. Okay, I love that. All right, so let's just break it down and just go simple because this also is another place where things get so complicated and verbiage gets so complicated. Like toner, what does that even mean? Like it can mean witch hazel, it can mean acid toner, like it can mean a million things. So I would say morning and evening, washing your face. I like exfoliating a little bit in the morning. We want protect and correct. So, protect is your SPF at the end of the routine. Correct is something like your vitamin C, maybe even a brightening serum. Those things are all safe during pregnancy. So, 4 or 5 steps in the morning, which can sound like a lot. If you can do nothing else, wash your face and put on sunscreen. I
Okay.
like moisturizer. Do we have to have it? Not necessarily. So then evening, you're going to want to wash your face and then again protect and correct. So at night, you're protecting maybe with an antioxidant and then correcting with an acid like a retinoid, or if you're pregnant right now, then maybe that's azelaic acid, maybe it's a bajillion of the other acids that I said. Skincare routines, we want the basics and then what are we targeting? Like when you get into these multi-step routines, it's are we targeting breakouts? Are we targeting rosacea? Are we targeting acne? And that's where we really get customizing. And there are products that I talk about all the time that then people will say, "Oh, I bought this thing. You said you love it." And I'm like, "Oh, you don't have rosacea. Like you don't need that. I love hypochlorous acid, but you don't break out and you don't have rosacea." And it's hard to remember to give a disclaimer every time of who doesn't need it. So there's a lot. There's a lot. If you just are doing 2 or 3 things in the morning, the biggest hurdle for a lot of people is just getting into the routine. And that's hard. Sometimes you're pregnant and you feel like crap. And then you have a newborn and you're like, what? You are about to feel like somebody put you in a trash can and kicked you down a flight of stairs mentally, emotionally, physically. It's so confusing. It's so confusing. It's such a confusing time.
Hear me like
It's
retinol. I don't even know where my water bottle
no. Oh my God. Retinol, who I can't put on pants. Like, what? I love this for you. It's so magical, but it is. And it really is. But yeah, we'll get there. And I say that to my patients all the time. Like, y'all, I saw a TikTok last night. Y'all love TikTok so much. And it was this lady who was like a few months postpartum. And she was like, when do you get your pink back? Like, what? I don't know what that means. I guess it means like, when do you start feeling like yourself again?
Yeah.
And I was like, oh, like years, like give it like a couple more, like several more years, and then it's a slow transition, and then you're like, okay, I'm a normal human again, maybe. But
Yeah.
and then you probably had another baby. It's a
That
lot.
the whole idea of Get Your Pink Bag was started by an influencer who had discovered that flamingos, when they babies, they actually turn white, and that's how you can tell the new mom flamingos is because they are white, and all of that pink actually goes to their babies, and then the more that they eat shrimp and they put back into themselves, they get
Ah,
pink back.
Who knew?
I know, isn't that so sweet? And also like such a good indicator of just
That's
how much you
wild.
give your children. It literally drains you of your whole color and it's
Yeah,
temporary. So I think it's very comforting to know like you will eventually get your pink back, but
totally.
in the beginning you are going to give everything. You're going to give your all to these babies and
Yeah.
that's by design. Yeah, cool.
And also, don't go shopping for several months postpartum. I just want to put that out there because things change and you don't even know that they've changed. Like my rib cage expanded in the weirdest way. And I don't think it's ever gone back down, which is fine. I didn't even notice it. And then I remember like putting on a shirt and just being like, what? This is weird. Like
This
it's
is
just
tight.
different. Yeah. Yeah.
This
Big back.
might fit like it used to.
Yep. Big back. That's me.
Oh my gosh. Okay, so what about sunscreens? What do we need to know about sunscreens? I know that there are some talks on the internet about anything over 30 doesn't do you any good, so don't waste your money. Is that true?
Okay, so there is a threshold for sunscreen where the increase in the SPF number is such a small incremental improvement that yes, for the daily wearer, like just your daily sunscreen for bopping around, which yes, I advocate for sunscreen every day.
Okay.
On it, you can't see this, but I'm sitting in, oh, maybe I can turn my camera around. I'm not that savvy, but I'm sitting in front of this giant window. Like my whole back wall is a window. So like I'm just, I might as well be outside.
Oh,
Do you drive a car? We're exposed. Like we have all the coolest is there's studies, truck drivers where the left side of their, we know the collagen on the left side of our face, skin cancer is more common on the left side of our face. They have truck driver studies where the left side of their face is like a different person. So just that cumulative effect. I like sunscreen every day. People I know get very concerned about vitamin D. The amount they don't, it's not a one to one, right? It's not as simple as quit wearing sunscreen and you'll make the amount of vitamin D that you need. That's not how it works. Most, particularly Americans, even African Americans, where they're making more melanin, they're more protected. Most of us are vitamin D deficient and need some kind of a supplement. Okay, especially when you're breastfeeding, your baby even will need a supplement. I think. Don't quote me.
yes.
That's not my
No, you're
area.
right. It is recommended by the AAP for the first year.
Little droppies, and we were terrible at that, admittedly. But so I like sunscreen every day. And my philosophy is, hey, I get it. Where there's concern about sunscreen, and we'll talk about that concern and whether it's valid. But we also know for a dead fact that the sun causes cancer and sunburns, sun damage. Take the aesthetic part out of it. So sunscreen as a whole, the reason there has been controversy as of the last 5, 10 years is because there are two categories of ingredients, right? One is called mineral sunscreen, which is titanium and zinc. That's it. The other category I like to call non mineral because people call it chemical, and then I think that freaks people out. So I'm like, let's just say mineral and non mineral. Those are avobenzone, oxybenzone, octinoxate, octisalate. And there is concern of does this non-mineral category actually get absorbed? Is it potentially endocrine disrupting? Yes, those are very valid concerns. Now, personally, if we're on the beach, I have one kid that like has no melanin, and if I need to reapply for her, she will get like a second. She's actually had a second-degree burn sun on her part of her hair before. If somebody's like, here's a banana boat spray, I'm using it. That's me as a parent because I've probably forgotten to pack her this one stick that she accepts on her body. You know how they are. So if you want to be as safe and cautious as possible, mineral only. Now, you also will see the word mineral and they have other non mineral ingredients in there. So, the two ingredients you're looking for that also do, yes, block, no, the iron oxide blocks the blue light. So, we'll talk about that. But zinc oxide and titanium dioxide are really the only two that you want that are mineral. So I get it. I get that conversation. There's a lot of times where I can be like, no, that's silly. We don't need to worry about that. But I'm like, no, that's a valid conversation to have for sure. But I think what's happened is now people have just said, oh, sunscreen in general is not safe or they're concerned about it. And that's just simply not true. It's a very small subset of a few ingredients that are really pretty widely used, but now we have incredible mineral options. So there's really no reason to say we don't use sunscreen. And the vitamin D thing, like I said before, that's not a one-to-one argument. You're not going to just quit using sunscreen and suddenly make enough vitamin D. That's not how it works.
Anecdotal story. A couple of weeks ago, I put up a post. So I talk about regularly getting outside without sunscreen, and I make a disclaimer that I'm doing it 10 to 20 minutes in the morning.
Yeah,
A, to wake myself up. I drink my coffee outside. I usually am like scrolling Instagram,
totally.
doing a first scroll of my email to see what came in overnight and to just kind of plan out my day. I'm not spending hours outside. So a couple weeks ago, I go to the beach and I put up a video of me putting on sunscreen, and oh my God, people ate my freaking lunch. They were like, "We thought you didn't wear sunscreen." And I was like, "Whoa,
Come on,
whoa." I'm like,
guys.
not going to the beach for 6 hours without sunscreen, people. There's a balance. And so much like you were like, it's hard to put a disclaimer. I sometimes do forget to fill in the nuances of I get outside without sunscreen first thing in the morning, and then I come in and do my skincare and
Yeah,
it has sunscreen in it. Like I'm still
yeah,
wearing sunscreen every day. When I go to the beach where the sun is going to be reflected off the sun and the sand, or the water and the sand, I'm wearing sunscreen. And it was a very good reminder for me. People just jumped my ass. They really
isn't
did.
it wild?
Yeah, they were like, "You've been lying. You do wear sunscreen." I was like, "Oh my God, you guys, like, wait a minute.
Relax.
Holy moly, slow your roll." I do wear, I've never advocated for no sunscreen at all. I have just simply said I also prioritize getting outside without sunscreen for a brief moment in time. I love to feel the sun on my skin. I do believe that it makes me a little tanner, which gives me a little bit of confidence. And I like getting out in the sun early in the morning for my circadian rhythm. And so yeah, holy moly. The sunscreen debate is
I
really
know.
wild. What do you think about the alternatives? Like, I've seen people do, what is it, like rapeseed oil or carrot,
Yeah, I
something. Do those
know.
actually work?
No, you have to think. So we talked about regulation in the beginning of this episode and how few products and ingredients are actually regulated in this country, and sunscreen is one of them. It's so heavily regulated because it matters. So
Oh,
you've got shelf stability, SPF rating. It has to be in a certain type of container. Like you'll think about it, you don't see sunscreen in a glass container. You don't see it in a clear container because the sun degrades it. You don't leave it in a hot car. It has a shelf life. It has to be shipped a certain way. All of that stuff matters. So, do I want to say, oh, none of these things offer any sun protection? No, of course not. I'm not going to say that. However, to make your own, you have no clue. For people to say that they're giving SPF numbers, first of all, the highest I've seen is like 8. So that's protecting you. Oh, I forgot to completely answer your question before about the SPF numbers too. But anyway, at best, you're getting an unstable, unregulated 8. And
okay.
that's, again, not studied. We don't know what the hell. Also, is it systemically absorbed? We don't know. No one knows because this is a thing we're doing. And then there's the whole watermelon juice thing. Now listen, does antioxidant, oh, if you haven't seen that, I can't even. Sure, antioxidant ingestion actually, yes, helps give you some internal protection, but it's 2%. It should be icing or even sprinkles on top of what you're already doing. If you had gone, also UV index matters. So, like in the morning, the UV index should be very low.
Okay.
Middle of the day, several hours, you go to the beach without sunscreen, you personally, as a medium Fitzpatrick 3, you're getting burned and potentially sun poisoning. Like, what? What?
Totally.
Who wants to do that? So we talked about the SPF numbers, and I think I got it's probably squirrel, whatever happened, but there's incremental improvement the higher you go past like a 30 to 50. So 50 to 100, I think I want to say you're going from 98% to 99%. Like it's so small. Now, if I'm a like we just went on the surf trip last week. We talked about where when the guys were leaving in the morning to go surf for 4 or 5 hours and they know they're not going to be able to reapply because they're literally in the middle of the water. They are coated. Their faces are white. They are
Wow.
coated in the highest SPF that they can find because that 1%, like you talked about with the water reflection, you're out there for several hours, middle of the day, UV index is a 9. Then SPF 50 versus 100, yeah, I'm looking for that. Whereas that daily use, that those high numbers, sure, smoke it if you got it, but like it's not a big, it's not the end all be all. If you have a 30 that you like to put on daily, that's great. I think it's very situational. Don't overthink it, is my philosophy.
Yeah, oh my gosh, mine as well. I try not to overthink a lot in life. Okay, what
It's
about the
hard.
new up and coming like powder? You can put them in your hairline, you can brush them
Yeah,
on your face. They're not creams. Do they actually
they
work?
work. They do.
Wow,
They
okay.
do. They work really well. You have to reapply, but I actually think they're great for, I don't love it as a base personally, just because I don't like the feeling of that powder as my base. Like I like a makeup-y feel,
Yep.
but I'll reapply with them. And then my kids, again, I talked about my daughter who got a second-degree burn in the part of her hair when she was 4. She had little braids, and you know how the scalpy, I know. So they're mineral based, most of them. I can't speak for all of them, but like Color Science, we love Color Science. They make a bunch of different shades. They make deep, dark shade, very light shade. They make a glowy one. But yeah, they offer the same protection and they're great. I don't want to do my whole body in it. It would be annoying. It'd be like putting makeup like on your whole body. So for face, they're great. I like little ears and part of the hair for little babies and kids. They're all typically all mineral. So yeah, no, they're great.
Nice. Awesome. Okay, and then my last question about sunscreen is the blue screens. Should we be doing blue screen specific sunscreen?
Okay, so any tinted SPF has iron oxide in it. Tinted mineral SPFs. Iron oxide protects against blue light specifically. So that's part of kind of the argument for women, especially for a tinted sunscreen, if you're willing to get a little bit of that blue light protection. I don't think we fully really know the repercussions of blue light. I think that will continue, honestly, to come out as we've all been on screens like habitually day and night for 15 years. I don't know how long we've been doing this, but yeah, blue light protection is it does matter. So iron oxide that you get in a tinted sunscreen will help with that.
Yeah,
Yeah.
that's good to know. I will say, just anecdotally, I do feel like ever since COVID, life just shifted radically, right? I used to spend probably 30 to 40% of my time behind a computer. Now I'm
Right.
spending 90% of my time behind a computer. And when I'm not on my computer, I'm working from my phone. And
Hmm.
it's when you think about, and I don't know if they're the same screens, but when you think about the new cars, we're looking for a new car right now, and they all have these
Oh yeah, no, I
one
mean,
screen and they're huge. They're
yeah,
not tiny screens. And I'm very
yeah,
not sensitive in the way that I like am bothered by lights. I just notice them. My husband does as well. And so when we go
yeah,
places and they don't have these warm lighting temperatures, we always are like, oh my God, these lights are so harsh. I do feel like since COVID, I have gotten more wrinkles, and I can only attribute that to spending an abundance of time behind screens. I know that COVID was stressful as well, so I'm sure that played into it a little bit. But to balance that out, I've gotten healthier. It has made me more health conscious. It has made me conscious of ingredients and what I'm doing in my daily regimen. I used to never, COVID, I never had a skincare routine. That was so silly. I was like, that's not for me. I'm young. And now I'm like, dang, I should have started this when I was 15. I wish I had been doing it
no,
for years. And so for me, I think I don't know. I definitely think there's something to being behind screens. I certainly think that the data one day will probably support that.
yeah, I do too. I do too. And I'll look for it. I admittedly don't really look, I haven't looked at the blue light data in a long time. So I'll look at that. And if I find anything that's worth reading, I'll shoot it over to
Yeah.
you.
Yeah,
Yeah.
please do. So, in terms of wrinkles, obviously they're on all of our minds, and I think it's very nice to have this mindset shift of wrinkles are just an indicator of how long you've been alive and how much you're
Sure.
loved and how many times you laugh a day, which, hey, I love that. I really do love that. And if I gotta have wrinkles, I love a good mindset mantra to help me cope with that. But the goal is to not have wrinkles. And I think a lot of people think that Botox is the only answer. Obviously, in pregnancy and nursing, they are commonly looked at as no-nos. So let's maybe shift
Right.
a little bit to Botox. Before we dive into the safety,
Yeah.
could you tell us what Botox is, who might
Yeah.
be appropriate for Botox, and then also what's the difference between Botox and fillers? Because that's very confusing to someone who is not necessarily in this world.
Okay, so cut. We're going to talk about this on episode 2 because this is a 2-hour conversation. No, I'm not gonna. All right, I'm like, whew, okay, let me give you my best like elevator spiel of what they are. Okay, Botox, botulinum toxin. Yes, it is a toxic substance. As always, anything toxic, dose makes the poison. So remember that. And Botox is a brand name, just like Kleenex or Coca-Cola. So there are six-ish versions of Botox. What Botox does, it works in the muscles. We have acetylcholine. It stops the cleaving of acetylcholine so that if you think about a piece of paper folding, it literally just tells the paper you're no longer allowed to fold for 3 months. So if our skin is paper, it won't fold. So that's what Botox does. It stops that muscle from folding the skin, which is the paper, and that's what forms the crease in the paper, which is the wrinkle. So that's my short spiel on that. Filler is a gel. It's typically made of hyaluronic acid, and it's a gel that we put in. Think about lips. Everybody has seen lip filler. That's the worst example because it just can be very off-putting. But filler is a gel that we put in to plump up where volume is needed. Honestly, anyone is appropriate for we'll call it neurotoxin or tox or Botox when there's really no age that it's a good idea or a bad idea. It's totally up to you. Like it's so subjective. I have literally 25-year-olds that have deeper forehead. I'm talking about hardcore etched in lines, whether it's genetics, whether they grew up, I'm in Charleston, did they grow up surfing? Did they smoke? Did they go to the tanning bed? I did all those things. So when I was 30 and realized like I look 50, I had to backtrack. Now I'm 41 and I look younger than I literally did 10 years ago.
Yeah,
So
you look amazing.
thanks, girl. And I've also, everyone just like, we just got back from Nicaragua and I'm like, I haven't washed my hair since we've been back.
I couldn't tell. I had no idea. I
It's
think
a
it's
lot.
great.
It's a lot. Thank you. You're so kind. So it's really whenever it starts to bother you. That's the first question I ask to people is what's bothering you? If something bothers you, yeah, we have tools to fix it. If it doesn't bother you, that's okay. Maybe your hair doesn't bother you. It's curly, it's straight, it's gray. Maybe it does. Maybe your pants, your style. I hate that we like demonize one thing versus another. It's who cares? If somebody loves makeup, cool. I'm not that good at it. I don't love it. I like it, but I'm not great at it. So I'm not spending 20 minutes on my eye makeup because I don't even know how to do it. For some people, that brings them great joy. Who cares? So it's really all about when is it appropriate for you. Filler's a little bit of a different story because it's doing different things. It's really filling in volume. So we have to assess globally and see, unless you come in asking for lip filler, truly, lip filler is kind of the exception to everything else we do with it. Like there are parts of the face, the fat pads, the collagen structure, the bone structure that bone starts to reabsorb as we age, or fat pads start to get smaller and they drop. So with filler, there is more of what we call facial optimization or global like balancing. So I might have to put some volume somewhere like your temples that you didn't ask for because you're like, wasn't looking at my temples. And I'm like, I know, but you're asking me for this, and to achieve this, I've got to balance it in this way. Does that make sense?
Yeah, absolutely. I never even considered that.
Totally different. Yeah, totally different things. So
So,
you might like sorry, so if somebody came in for lip filler and I'm like, yeah, but you have a tiny chin, and if I do your lips, it's gonna totally overwhelm your face. It's just it's a different conversation.
yeah,
Yeah.
absolutely. So your face shape matters a lot when we're talking about what kind of aesthetics we're going.
Yeah. Yeah, and people are terrified of filler, I think because of that Real Housewife aesthetic. And I say to them, guys, someone should have said no. First of all, it takes an incredible amount of volume of filler to get to that point, and someone should have said no 8 appointments ago. I couldn't make you look like that if I tried. Like I wouldn't. If someone can look at you and see that you've had filler, I haven't done my job. I didn't do
Right.
a good job. It's my opinion.
Okay, so filler can be dissolved. Can Botox
Yeah.
be reversed as well?
Reversed, no, but it goes away. So filler can be actually dissolved. Yes, there's a substance called hyaluronidase that is not pregnancy safe. So we really shy away from filler during pregnancy because it's not the filler itself that's unsafe, but if there was an issue and we needed to dissolve it, that's not pregnancy safe. Botox, you can't reverse it, but the average that it lasts is about 3 months. So we're like, worst case scenario, you hate it, like it's going to go away. And neurotoxin, it's interesting. There are certain sources you'll look at. Hippocrates is one that says, I think it's pregnancy category B. There's certain that say it's X, it's no. There's some animal studies that say that it does get across the placenta during pregnancy. It's different now than it was, I think, because we have so much retrospective data. People have been using it for so long and then finding out they're pregnant. That's where that data comes from. Now, I do not in my practice do any neurotoxins while pregnant. I don't think it's worth it. I think nursing is a good conversation to have. You can get permission from your OB. Now, that being said, what's interesting too, a lot of people don't realize we use neurotoxins in the medical setting actually at a much higher volume than we do in aesthetics. So if you got the migraine, let's say you came in for an aesthetic treatment, average dosing is 50 to 65 units. The migraine protocol, 151 units. And they now are saying, hey, if this is your main migraine treatment and you're pregnant and you need it, it's okay. We're going to give it to you.
Wow, okay.
Yeah. So it's interesting. It's a little gray. It's always safest to not, but that's just a little tidbit.
Yeah, I can speak to that. My sister suffers from migraines and she has done Botox treatments for a really long time and they actually work. And I had a lot of hesitancy when she first shared that she was going to do that. And I was like, just be very careful. It just makes me really nervous. It is a toxin. And
Yeah.
it gives her a lot of relief. And when she doesn't get them, I mean,
Right.
we're talking about someone who gets like 15 to 20 migraines a month. So you're talking about someone who has
It's life altering.
it's life altering. And when you
Hmm.
don't have it, it's life debilitating. You're talking someone that
Right.
has 10 days a month that you don't have a migraine that puts you to bed
Yeah.
in a dark room. You need ice
No.
on your head. You can't get up. You're nauseous. You're throwing up. That's just no way to live. And yeah, Botox definitely gets a bad rap. I think people are very scared of it, which there are definite like harms can come from it. I think everyone
Anything. Yeah, absolutely.
things that can happen when Botox goes wrong, but I am here to say that there are good uses for it when it is used under proper clinical supervision and with intention. And I'm never a completely write something off person. I just am not that way. I'm not that way with C-sections or induction or seeing an OBGYN or home birth, or I just think it's about appropriateness and using it in a way that, like I say, is with intention and a very true and transparent conversation about the benefits and the risk and
Right.
what your goals are with doing whatever you're choosing to do. So we've done a lot of talking about pregnancy. What about Botox in nursing? Your baby's now on the outside. We know that breast milk is very protective. Is it something that we can resume again, getting our Botox while we are still breastfeeding?
Again, it just depends on what source you're looking at.
Come on, Claire, give us something good.
Listen, does it go into the breast milk? No.
Okay. All right.
So if out of an abundance of caution, you can always ask. We was also hilarious. Okay, so my dad and my brother are both pediatricians. You'll love this actually. My dad's been retired since COVID. But my brother's fresh, he's young, he's in his 30s. And I remember with my first baby, I'd call my dad. I was nursing. I'd call my dad, and he's, I don't know. I have mastitis, or what's the deal? And he's, I don't know. Call your OB, and they're maybe call a lactation. It's no one owns like nursing
Yep.
except for lactation consultants, and then that's like a whole nother ball of wax. Because are they a nurse? Are they like don't give them a passive? Oh my gosh, there's people have had some real traumas from lactation consultants, and some of them are the best people on the planet. And like our mutual friend Hillary Sadler, who's like talks people off
Yes.
the ledge all the time.
Yes.
So my brother hired for his pediatric practice, he hired an RN lactation consultant. She's free for his patients. And any nursing breastfeeding question, he's like, go ask her. And just, this is her deal. So she has that medical training. Of course, she has him if she ever needs, do we need to worry about the weight, whatever. All that to say, you could ask your pediatrician, they'd be like, I don't know. Ask your OB. OB may be like, I don't know. It depends on like how into it your provider is, which is crazy. But I would say most of the time when I have people get permission from their OB, it's a yes. They're like, yeah, it's fine. We know it doesn't go into the breast milk, so it's fine.
Yeah, that's super helpful. Are there any resources online that people can look this stuff up themselves, especially if maybe their OB is not seeing eye to eye with them, or they're hoping to maybe look up the information themselves outside of their OBGYN because it wasn't much of a
Yeah,
conversation and they didn't feel heard?
no. I think it's tough. I'll look again on ACOG and see if they have a new stance on any more clear information because again, like it's right now, there are certain things like this that are going to be source by source. So you could look on, people like to go on PubMed. Okay, you can find 100 studies on PubMed, but what is it? Is it a randomized controlled trial? You're not going to find that right now. It's all going to be retrospective and oh gosh, it's just tough. And I think it's important. All this stuff is so temporary. It's not a lifelong punishment like you have a baby and nurse that baby and you never get to have it again. There's a lot that you can do. There's little light peels and facials and microneedling and all these things that you can do to maintain that collagen. Of course, even your neurotoxin outcome is never going to be as good without that at home work of daily maintenance with your skincare. So just think about that. If you're like, I can't buy clothes, I can't get my Botox, you can get a bang up skincare routine with all that money. Get some micro needling, get some hydrofacial in there, trying to think about there's some little pregnancy safe peels that we have. It's just a kind of light lactic acid peel. There's stuff that you can do.
Cool. Okay, I want to dive into the microneedling because I was getting it every other
Hmm.
month for the
Hmm.
last 2 years. And on the months I didn't do microneedling, I was getting hydrofacials. And so once a month, I was having some sort of treatment for my skin.
Something.
And I just felt amazing. I felt like my skin was top of the game. I am 34. I felt like I looked just so much younger. And then I got pregnant and I went twice in the first trimester. And then my esthetician said, I won't be able to see you until after your baby is here, but it seems like you have a little bit of a different opinion. So, what do we need to know about microneedling in pregnancy? Because I would love
Yeah.
to resume that.
Yeah. So I think it's also different when an esthetician or even an RN, which we love, they're part of the aesthetics team, they're critical to all of our practice, but they have a different education and scope of practice. So for me, I'm able to diagnose and prescribe. A nurse is not able to do that, and even less so an esthetician, right? And so I am comfortable in my practice saying, okay, here is the issue with microneedling in pregnancy. It's the numbing cream. Were you even getting numbing cream? It's not the needles itself. Otherwise, we'd say you can't have acupuncture, you can't have dry needling, you can't have a bajillion different things. But it's not the procedure itself, it's the numbing cream. So there are certain formulations of numbing cream that we would not use. You also don't have to numb at all. There are plenty of practices that don't use numbing cream. I know, right? You're like, ah.
I
Now,
would die. I
you
usually am like, are you sure you want to wipe it off right now? Can I have a few more minutes?
so, like in tech, if you want to get again super technical, plain lidocaine topical in just the face amount. I'm not saying let's do face, neck, chest, arms, hands, like that's aggressive in any setting, but plain lidocaine is considered pregnancy safe at certain percentages. So it depends. If they're using a 25% lidocaine, 7% tetracaine, 10% benzocaine. No, we can't use that in pregnancy. But it also, I'm sure it's like the deeper you go with microneedling, obviously the more uncomfortable it is. So if you're like, okay, my best bet is to just not use numbing medicine, suck it up for it takes 5 minutes. Like the actual treatment takes 5 minutes. You would just go light. You would just do like a light thing. You'd be fine. You'd be fine. You'd be fine. Yeah,
I
it's
might
fine.
just test it out before I have this unmedicated birth of mine.
Yeah, perhaps. 'Cause let me tell you what is significantly more painful than unnumbed microneedling, and that is a contraction.
Oh my goodness, it's a nice
Ah,
practice round. How far in advance, if a woman knew that she was going to try to conceive, how far in advance should we stop Botox and retinol and filler and all of the things that we've talked about being
yeah.
in general no-nos, but there are some exceptions.
Yeah, that's a good question, and there's really no hard and fast answer. And I can tell you just from my experience over the years, even with people going through IVF and embryo transfers and all of that fertility treatment, the kind of industry standard answer is when you get a positive line on that pregnancy test, you quit the things that we've told you to quit. And that's where a lot of that, it's probably pregnancy safe data is coming from, is people who didn't even realize they were pregnant or they weren't trying to get pregnant, like some people we're talking to today. And all of a sudden they are pregnant and they're like, oh my God, I got Botox last week. What am I supposed to do? So don't overthink it. You do when that's when you know better, you do better. Just like everything, alcohol, sushi, whatever it is, as soon as you stop doing it. But now, and obviously there's nuance, should be nuance to every conversation. If you're going through if you're going through it and you're in never ending fertility cycles, it's also a really tough and interesting conversation. There are some people that I talk to that are like, I feel so out of control of my body during this treatment that I want to be in control of something. And I know I just can't imagine you just start trying to control every aspect of your life. Did I too much BPA from the canned LaCroix, but I wasn't drinking alcohol, and was it this skincare? Was it this? It's just so overwhelming. And so I think it's a very individual conversation too. And if somebody says, listen, I'm going to start TTC in September, and that's when I want to do the most to maximize, it's not that your chances, but just your kind of knowledge of that you're doing everything that you can, that's fine. I'm going to support whatever you want to do. And also I like doing skincare consults. I do skincare consults all over the country all the time. And what's a cool conversation for me is saying to someone like, oh, yeah, okay, so you're about to start trying to get pregnant. And they're like, I don't want to spend $300 on this routine or this product and then I can't use it and then it expires. I'm like, okay, here's what we're going to do. We're going to build an entire routine that is pregnancy safe so that when you get pregnant, you're confident. And if you want to add in, have that retinol on standby and you're not pregnant next month and you want to start it, cool. But if not, there's still, again, so much that you can use and feel confident that you're not doing any harm.
Yeah, I love that so much. And I got to be honest, that's where started and I ended was I had started a couple of years ago doing what I thought was pregnancy safe. And I shared at the beginning that like I was surprised to know just how many of my products weren't pregnancy safe or that I needed to get rid of or I needed to just lay off a little bit. But yeah, I did. I started to be like, all right, I know I'm trying to get my body in a place to make and receive and keep a baby. I wanted to go ahead and do all of the things early on so that when I got pregnant, I didn't have
Mm-hmm.
super amounts of shifts. And for me, I found that to be really easy. And honestly, it helped my mental load a lot when I first got pregnant because you're already changing so much. You're adding in prenatals and you're adding in this. And for me, I needed to step up
Right.
my workout routine and I needed to end my days
Right.
earlier so that I could get proper amounts of sleep. I was really focused on protein intake. There was just so much mental load that it was helpful for me that I didn't have to change every single thing in my skincare. I just had a couple of things that I needed to remove rather than overhaul it completely. That was really
Totally.
comforting for me.
And I think too, the hormones that we have no control over during pregnancy play such a huge role that there are so many other things that you can worry about to really prepare yourself physically, especially gosh, and then you get into PCOS and Hashimoto's and all these other things. Like it can get so overwhelming. So I like the last thing you need to do, even if you were using the only two true, let's call them true no-nos in pregnancy, which would be the retinoid family and then hydroquinone, which we haven't even talked about. I don't use hydroquinone in pregnancy, but there's actually no human carcinogenic data. Like it's like it I just feel like there are so many other things that are going to be ultimately more important to your baby. Alcohol. If you want to stop drinking, that's probably a bigger going to be a bigger impact for you. Like you said, start exercising. My God, if you haven't, like that's huge impact in fertility. And then we get into the GLP-1 space and that impact in fertility and excess weight that most Americans are carrying. There's just a lot bigger fish to fry than skincare that's highly unlikely to get systemically absorbed and impact your fertility in a
Mm.
meaningful way.
Yeah. What is hydroquinone and when do you use it?
Hydroquinone is a bleach, like a literal face, like skin bleach for pretty significant melasma. People get that
Oh,
mask. Yeah.
which
Now,
melasma can happen in pregnancy.
oh, total. It's awful. It's so frustrating. And that we will use, I use it sparingly just because of those kind of question marks. But when we need it, we use it. So ideally, you wouldn't be using that. And we touched on fertility too. Like my friend, I don't know if you follow Lauren Maneker. She is a dietitian, but she basically focuses solely in the fertility space, and everything
Okay.
she puts out is like fascinating. She went through IVF and everything too. But we've had some good conversations about, so I have people who are at different levels of what they want to control. And there is some data on potential endocrine disruption of not your major ingredients, but little things like phthalates and parabens that are used as stabilizers, preservatives. So then, if I do have somebody that's I'm all in, I want the safest of the safe, then I'm like, okay, here you need these are the lines that we stick to because these are the ones that, and maybe that's clean to you. We talked about clean. Maybe that's what clean means to you. It's different for everybody. And some people are like, I've got raging acne. I've been doing this for 2 years. I don't give a shit anymore. Burn it all down. So we just customize as best we can for everybody, and everybody's in a different boat.
Which is the whole idea, right? Especially when it comes, I say this all the time about women's health and pregnancy and the care that you're receiving in labor, but it's especially true in skincare is because your skincare, your skin type is as individual as your fingerprint. You are not going to have the same skin as even probably a sibling. Similar, yeah, but probably not the exact same. And so making sure that you're getting that individualized care is
Oh
really
yeah, my two girls came from essentially two different families. Like one of them is, I looked at her back last night and I was like, why are you so tan? Whose child are you? And then the other one, she can't look at the sun without a second degree burn. It's unbelievable. Same parents, we think, but what's happening? They're so different. It's crazy.
Genetics are so wild, which
I
segues
know.
me into my very last question. And when I asked my audience what they would want to know from you, this was the number one thing right behind
Oh,
or right ahead of Botox. So Botox was number two. They wanted to know all about it. And the number one thing that people want to know, and you're not going to be surprised, but tell us what we need to know about preventing stretch marks.
you're not going to like this answer,
You can't.
gals. You can't.
Oh,
No. It's genetics. And it's really frustrating to see. There are some people in the space that I like you as an influencer and your clothes are cute, but don't be making a stretch mark. Come on, get out of here with that. There's nothing that has been shown to actually prevent them. It's genetic. It's based on the amount of weight you gained, the skin you did or did not have before. There's a reason why some of these supermodels literally can walk the runway like 6 months after birth. They are literally God's favorite. They're genetically blessed. They have been. They're double D, but 22, and they've never seen a stretch mark. Okay, that's why they get paid several $1 million by Victoria's Secret, and that's none of my business. That's not me. So, that in mind, I'm so sorry. There are things after, okay? We can laser, we can microneedle, we can do retinol. There's some fabulous Skin Better makes a beautiful retinol body cream. There are things to do after. And that's what you just need to focus on. I know it's so frustrating. Some of them are literally painful. Some of them are actually painful. Those you can tell, like you can see if you see like a big red or like even brown striae, like it's actually can be quite painful. And I hate it for people because there's really no rhyme or reason other than the genetics. But it is what it is, and we'll do our best after to help you get rid of it.
Yeah, that's helpful to hear. I think comparisonitis is wild. It makes us compare ourselves, our bodies, our lives, our purchasing power to everybody around us. And social media has only exacerbated that and it makes you compare
So,
yourself to every single person. So I think it's really helpful to know that we really don't have that much control over stretch marks. Would you say that hydration can help but not necessarily prevent them?
support your skin from the inside out, of course,
Okay.
internal hydration, external hydration might be somewhat helpful. It's just, it's not going to prevent them. And the amount, this is where you get into that like no category in terms of a retinoid, the amount that you need to put on consistently. It's like a bigger amount than your face. It's just, that's not worth it. We'll hit it hard after. But like, there's an influencer who I love. She's so pretty and just, all her stuff is fashion. And she's had 3 kids. And after her second kid, she developed this like stretch mark cream, and I'm like, that's not why you didn't have stretch marks your first 2 babies. Like, you are genetically blessed. But she can sell it because she don't have stretch marks. And then she had a third baby and didn't have stretch marks, which she wouldn't have anyway. So it's just, it's
Yeah.
sad.
Yeah. I will share my stretch mark regimen online, but in the video, I do say so much of this is your genetics. So just because this is working for me, please don't think that it's necessarily the reason I don't have stretch marks. And also, I'm not all the way fully pregnant yet. I'm not due until November. And so I still have a long way to go in pregnancy. So while I don't have stretch marks right now, it's not to say that they're not coming my way.
Totally.
But I do love to share what's working for me, and I love to share the products
Yeah.
I love, but it does not in any way mean that they have prevented stretch marks for me. And I did want to make that really clear in the video, and I say it again in the caption. And because again, I just think there's a lot of misinformation online, but I also think that it can really be bad for our mental health when we are taking advice from people who don't know what they're talking about and are selling us
Yeah.
a pipe dream that at the end of the day is not really true.
Yeah. It's a bummer.
Yeah, it is. But again, like wrinkles, your stretch marks are just a indicator of how much your body
Exactly.
grew and grew that baby and how loved you are and honestly how capable your body is. And I say this all the time, but I do think the human body is fascinating. I think it is very wise. I think it is incredibly smart. And the things that it can achieve throughout our 100 years here on Earth are just mind blowing. I really do. It can heal itself, it can grow a whole other human, it can overcome so many obstacles. And I'm, for one, really grateful for my body. And I try and instill that confidence in our listeners as well. Oh my gosh, Claire, thank you so much for being here. This has been
Thank
truly so much fun.
you.
I love your compassion for what you do. I love your individual care that you give your people. I love how real you show up. I think it's really hard to
Thank you.
find content creators. I'm not going to use the word influencers because I know you probably don't identify with that either. I certainly don't identify with the word influencer. I'm a
I don't
content.
know what I am.
I know. And I
I,
feel lucky that I get to influence people. I do take that
yeah.
as a big honor, but I think it's really hard, or in my experience, it has been really hard to find other content creators who are genuine humans and just show up them regular selves. And I am grateful for you. So if people wanted
Thank
to
you.
connect with you or they wanted to learn from you, I had talked about some of your offerings before, and you also have a skincare line. So tell us all about everything that you offer.
Yeah. Okay. My company is called the Skin Clique. And you can find me on Instagram, probably the easiest, at Claire O'Brien NP. And my name is spelled with a Y, so I'll have to send it to you because it's confusing. But Claire O'Brien NP on Instagram, that's where I put everything. I've got curated shelves of pregnancy safe, which is helpful. And we take that, I take it really seriously and I get it. And I love doing consults. Like I said, I do pregnancy consults, nursing, postpartum, all of it, acne. And if you're in a state that I'm prescribing, we do prescriptions if you need. But yeah, my company's called Skin Clique, CLIQUE. So you can follow along as well with Skin Clique and come find me on Instagram.
I love it. You guys, Claire is, yes, she's in skin, but like I say, she's just so much fun. She shares about her life and her travels and the fashion and just if you like my vibe, you're gonna love Claire. So head over to Instagram and give her a follow. And you guys, I know that skincare is overwhelming and I know it can be like doubly overwhelming in pregnancy, and that's why I wanted to have Claire on the show today. I wanted to break it down for you in a really easy digestible way so that you could feel less overwhelmed. My goal as your doula and as a best friend on this journey is to help lighten that mental load. I really want you to not feel so burdened in pregnancy. I want you to enjoy this time. And so when I get to have professionals on like Claire that can help do that for you, I just feel feel really honored not only to have our guests, but to be able to show up for you guys in this way. So thanks everyone for tuning in. I'll see you in the next episode. Be sure to follow Claire on social media, and you can find me at Tranquility by HeHe and at the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye. Thank you so much for tuning in today. I love hanging out with you, and it is an honor to be your go-to gal when it comes to preparing for your baby. If you've enjoyed today's episode, please leave a 5-star review and tell others why they should be listening to the Birth Lounge podcast too. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent without all the trauma that you so commonly hear about on social media. New episodes air every Wednesday and Friday. Hit that follow button so you never miss an episode. I'm HeHe, and this is the Birth Lounge Podcast.